Gentlemen, I want you to imagine waking up tomorrow morning with the kind of firmness you haven't felt in years. No pills, no pumps, no risky treatments, just using your own hands and a few minutes of simple, precise stimulation.
Urologist with over a decade of experience helping men reclaim their sexual vitality. If you found this helpful, click subscribe and ring the bell to stay updated on our latest content.
This by improving blood flow, relaxing the right muscles, and boosting nerve responsiveness. If you've been missing that automatic morning rise, stay with me because by the end of this video, you'll know exactly where these points are, how to stimulate them safely, and how often to do it for real results. Before we get into the where and how, you need to understand why this works. You know the science behind it, you'll realize you're not just pressing on skin. They are the result of a carefully coordinated dance between your brain, your spinal cord, your blood vessels, and your nerves and your muscles. It all starts with nerve signals, tiny electrical messages that travel at the lightning speed from your brain or sensory nerves to the erectile tissue. I'm able to pulse. Those signals tell the smooth muscles inside the penis to relax, which allows blood to rush in and fill the spongy chambers known as the corpora cavernosa. As they fill, veins that normally drain blood away are compressed, trapping the blood inside and creating firmness.
Now, where age changes the game. Over time, the blood vessels in your pelvic region can stiffen due to reduced elasticity in the arterial walls, a process accelerated by years of wear and tear, mild inflammation, or condition like high blood pressure. At the same time, nerve conduction slows, meaning those electrical messages from your brain or sensory receptors don't travel as quickly or as strongly as they once did. This double hit, sluggish circulation and weaker nerve signals, is one of the main reasons their morning meters. Erections start to fade after 50 or 60. Targeted pressure point stimulation works because it sends an immediate wake-up call through your nervous system. When you press or massage specific points, you activate clusters of sensory nerve endings that feed directly into the reflex pathways linked to erection control. These signals don't just stay local. They travel to the pelvic nerve plexus and even up to the spinal cord spine. The nervous system tells the smooth muscle in the penis to relax, the arteries to widen, and the blood to flow more freely. But it doesn't stop there. Stimulating them can improve their tone and responsiveness, making it easier to maintain firmness once you have it. This is why the effect of pressure point work is often twofold. When you press or massage the right spots, you're essentially bypassing some. Computer, clearing the lag, refreshing the signal, and letting the hardware and software work together smoothly again. Done regularly, this type of stimulation can retrain your erectile reflexes, improve vascular flexibility, and even or indentation, almost like a natural hinge where the erectile tissue blends into the deeper structures anchored in the pelvis. This area might feel subtly different from the rest of the shaft, slightly firmer or more textured, and others. That's because it's a meeting point of important anatomical structures. Why does this spot matter so much?
Beneath your skin, here lies a dense network of end control hub where signals from your nervous system and circulation converge. By stimulating this area, you're essentially lighting up both your nerve pathways and your vascular system at the top. Apply gentle but deliberate circular motions to the base groove. You're sending two important messages to your body. First, you're telling your blood vessels, open up and let more flow through, which boosts circulation. Second, you're telling your nerve fibers, wake up and get ready to transmit signals more efficiently. Signals arrive, whether that's during the morning or later in the day. The point of pain. Make small, slow circles. Let firmness of your pressure, especially if you feel the tissue beginning to soften. And relax. You might notice a pleasant warmth, a subtle tingling, or even a sense of fullness starting to develop. Those sensations are your body's way of is becoming more responsive. If you don't feel much at first, don't worry.
If you found this helpful, click subscribe and ring the bell to stay updated on our latest content.
Consistency is key. Over time, daily practice will heighten sensitivity in this area
And make the results more noticeable.
the base groove daily in the morning, ideally before you even get out of bed, and when your body is naturally relaxed. A warm shower is another perfect time.
As you commit, the heat will already have softened your tissues and improved blood flow.
Area, the perineum. This is that soft, slightly springy patch of tissue located between the scrotum and the anus. Many men overlook it entirely, but in terms of
Sits directly above the bulb spongiosus muscle, a key player in maintaining
muscles in your pelvic floor, responsible for trapping blood inside from escaping too quickly. Over time, especially with age, this muscle can
weaken if it's not actively engaged, making it harder to maintain strong.
reflexively activate this muscle, essentially giving it a workout without. Even doing a full set of Kegel. To locate it, either sit in a comfortable, usually your index and middle finger work best. Press gently but firmly into the center of the perineum. You're not pushing hard enough to cause discomfort, but enough to feel the underlying muscle respond. Move your fingers in slow and muscles waking up and your circulation responding. Spend 2 to 3 minutes here. Keeping your touch steady and controlled. For an added boost, pair this with light pelvic floor exercises like keels, either before or after the massage. This combination doesn't just help in the moment. It trains the muscle to contract more powerfully during. The perineum may be out of sight, but when it comes to restoring morning, known as the glands, and more specifically, we're targeting the ring-like ridge where the glands meets the shaft, called the corona. This area is packed with an incredibly dense
Concentration of sensory nerve endings. These nerves are your body's main
can heighten nerve responsiveness, making it easier to transition from circuitry, so it responds more efficiently when the time comes. This point works best when the stimulation is controlled. Too much intensity here can
overwhelm the nerves and have the opposite effect. To work this area,
Them on either side of the corona. Lightly pinch the ridge and hold for
about 5 seconds. Then slowly release. Repeat this hold and release action for
roughly 1 minute, making sure to keep the pressure firm but comfortable.
After that, switch to slow circular motions around the entire circumference of the umphren
without causing friction irritation. This second minute of circular work
and helps wake up the sensory pathways even more, encouraging faster signal out of the glands ring in this moderate rhythmic way can lead to stronger, more frequent morning erections.
Reverse templifying erections. You may also notice an improvement in overall
spontaneous. Remember, this is not about overwhelming the nerves. It's about gently reconditioning them to respond the way they did in your younger years.
Think of it as a daily reminder to your body of how good blood flow and nerve.
These 3 points, not as isolated tricks, but as parts of a single intentional routine. Here's the sequence I recommend to my patients for maximum benefit. Begin with the bass groove for about 90 seconds, making those small and steady circular motions until you feel the area warm and responsive. Then shift in deliberate circles to activate the pelvic floor and encourage deeper circulation. Finally, finish with the verters by gentle circular strokes to reawaken nerve sensitivity. Done back to back, and this sequence stimulates blood flow, engages muscle support, and sharpens arteries to set the right expectation. This is not a magic button that transforms things overnight. Your body needs time to adapt, to retrain those blood vessels, muscles, and nerves to work together again. However, many of my patients start noticing subtle but encouraging changes within just 2 to 4 months.
For truly lasting improvements, pair this daily pressure point routine with healthy lifestyle habits. Staying well hydrated
Throughout the day keeps your blood volume and circulation at their best. Keeping your pelvic floor strong, with exercises like keels, adds to the firmness you'll notice from the quadricers technique. And don't underestimate the power of nutrition. When you make these steps part of your daily rhythm, the benefits tend to multiply. The point, served become more responsive, circulation improves, and your body begins to remember how to perform the way it once did. It's about creating an environment that's safe, drug-free, and completely within your control. Gentlemen, you don't have to accept weaker or disappearing morning erections as a normal part of aging. Your body still has the ability to respond. It just needs the right stimulation and support. By pressing these 3 points daily, you can retrain your nerves, restore circulation, and bring back that morning
confidence without drugs or risky procedures. If you found this helpful,
Click subscribe and ring the bell to stay updated on our latest content.